Hi, I'm Colt Leggett, and I'm a senior licensed broker with Medicare Solutions. Now, here at Medicare Solutions, we specialize in helping people connect with Medicare plans that look out for both their medical and financial well-being. And our service comes at no cost whatsoever. Today, I want to talk with you regarding the 3 ways you can get your coverage needs met with Medicare. Now, the first way is with Original Medicare. If you decide to go with Original Medicare only, there is some significant financial exposure you should be well aware of. For starters, Medicare is broken into 2 parts. You have Medicare Part A for hospitalization, Medicare Part B that covers you for doctors and outpatient services. So if you're ever hospitalized, Medicare Part A kicks in, but first you pay a $1,340 deductible. After you've covered that, Medicare will pick up some of the bill. When it comes to Medicare Part B, that's going to help you with doctors and outpatient services. However, you're still having to pay $183 before that plan kicks in. After it kicks in, Medicare will pay 80% of the bill, but you still have to pay 20% yourself. The concern there is not the 20%, rather the uncapped aspect of it, meaning the bill's $100, you're going to pay $20. Not a big hit to your finances, hopefully. But if that bill's $100,000, you are then responsible to pay the $20,000. That is 20% of that amount. That can get very, very costly when you think about it that way. So there's 2 ways that we can help you protect yourself financially once you have Medicare. So this option 2 we're going to start to talk about here is called Medicare Supplement, also referred to as a Medigap policy. Now, Medigap, the reason why you have that gap in there is because it covers the gap in Original Medicare. Original Medicare holds you responsible to pay 20% uncapped. They cover it and put a cap, so you don't have to worry about that out-of-pocket exposure. Deductibles, Original Medicare holds you responsible for. These plans can also be used to cover that depending on the supplement that you choose. You could see both deductibles covered or at least the Part A deductible picked up for you. Ultimately, with these plans, you have something working hand in hand with Medicare, so you can see any doctor in the entire country that accepts Original Medicare. So the entire Medicare network is your doctor network, which gives you a lot of flexibility. The trade-off with this plan is it can sometimes come at a higher monthly premium, but a lot of folks who enroll see that monthly premium as an investment in their healthcare future. So when they do get sick, they're not having to worry about raiding their savings accounts or throwing a GoFundMe account up. They prepay their hospital costs by paying the monthly premium on a Medicare supplement. And again, there are multiple Medicare supplements offered. We can help you explore which one makes the most sense for you. So that's option 2, right? Now there's option number 3. This is called Medicare Part C, otherwise referred to as Medicare Advantage. The advantage of this policy is that you're going to get coverage for both Medicare Part A, Medicare Part B, and Medicare Part D prescription drug coverage. Now there goes a term I haven't said yet, prescription drug coverage. Now, Original Medicare does not include any prescription drug coverage help. You have to buy that separately. Medicare Supplements, they don't cover prescription drugs either. You're going to have to get a separate policy. However, with Medicare Advantage, you can select options that will cover you on both the medical and prescriptions. Now, the medical side with Medicare Advantage works like this. You're paying a copay. To see your primary, you pay a small copay. To see a specialist, you pay a copay. For even outpatient services, if you're going for a hospitalization or if you're going for an MRI or you're going for a surgery, typically these plans will give you a set copay. But the other beautiful part about these plans is that they put a cap on your out-of-pocket cost. If any reason your copays and coinsurance hits a threshold of $6,700 for 2019, the plan will stop billing you. They will pay the rest of your hospital stay. So the example earlier where on Original Medicare, the bill's $100,000, you pay $20,000. On a Medicare Advantage plan, you don't pay that $20,000. You're going to pay at most the $6,700, sometimes even less, because the copays in your plan keep your costs controlled. And like I said, these plans can be a much low premium, sometimes low as $0. In the end, the way these plans work is something you want to pay attention to because the trade-off is going to be in your doctor network. And there's 2 versions of Medicare Advantage we're going to talk about today. You have Medicare HMO plans and Medicare PPO plans. The HMO plans are the ones you hear about where you have a strict network of doctors, meaning if you want to see a doctor that's not in your plan's network, you won't be covered. However, if all of your doctors are in your plan's network, you're protected and you can see all your doctors. And the beautiful part is that your primary care physician will facilitate your care and submit referrals to see a specialist. I don't know about you, but whenever I see a specialist, I let my primary help me with the referral process. So that might be an advantage for you. The other side of the coin is the PPO plans. These have doctor networks where you get a discount, but you can go out of network and just pay a little more to see that doctor. So you still have an opportunity to see doctors both in network for a discount or out of network doctors. So that's Medicare Part C in a nutshell. I gave you the supplements in a nutshell and original Medicare. It may still be confusing. You may still have questions. And if you do, that's okay. It makes sense. You should have questions. The good news is you have Medicare Solutions brokers who can help you navigate through the Medicare gauntlet, help you make an informed decision so you get the best plan for you that fits your medical and financial well-being in the future. So I encourage you to take the time to call the number at the bottom of the screen or click the link so you can get more information, because you owe it to yourself to make an informed decision regarding your healthcare future. Thank you.